Think of the term movement disorder. What kind of visuals come to mind? You may think of someone you know who has trouble walking or speaking. The person may have a tremor. They may have difficulty with coordination. Whatever comes to mind, it is likely you are envisioning a loss in motor control. When we think about movement disorders such as Parkinson's disease or dystonia, we associate dysfunctional motor functions. But since we are talking about neurological issues, should we consider sensory abnormalities? It turns out we can detect movement disorders by measuring how people experience the world around them. Cervical dystonia is a rare disease that can have a profoundly negative effect on someone's life. Patients of cervical dystonia describe the feeling of having your head caught in a corkscrew, where muscles involuntarily contract in opposite directions. Symptoms scale from the level of frustration to extremely painful and debilitating. While a few pharmaceutical interventions mask some of the symptomatic effects and provide relief to the patient, they can cause further issues down the line due to muscle weakness and instability. There is no cure. Research taking place at Trinity College Dublin has helped establish an endopheno biomarker for studying dystonia. Patients have been shown to demonstrate a delayed temporal discrimination threshold. That is, patients have a hard time telling if events occur at the same time or asynchronously. If you were to present subjects with two short pulses of light in your peripheral vision field, and if the time increment between the visual stimuli increases, dystonic patients take longer to notice temporal difference between stimulus pulses. Abnormal temporal discrimination threshold, or abnormal TDT for short, has been reported in 97% of cervically dystonic patients and about half of their immediate relatives. But interestingly, only about 25% of relatives experience a physical onset of symptoms, which usually occur between the ages of 40 and 50 years of age. This suggests that there are some environmental factors yet to be discovered that are either protecting or promoting the development of this disease. So far, the TDT test has been carried out in clinical settings with limited numbers, and there is often a lack of standardization between different research groups. My research will change this by bringing the test to the individual and for the first time being able to amalgamate data from around the world. More data will allow us to ask better questions on the causes of dystonia and how this condition is passed genetically through families. By leveraging inexpensive yet powerful technology such as smartphones, we can measure TDT in patients from their home with the same scientific rigor as clinical tests. Trinity College Centre of Biomedical Engineering has an established network of well-characterised patients in St. Vincent's Hospital, as well as a network of colleagues researching dystonia across Europe and in North America. My research will empower future researchers to ask more ambitious questions and ultimately help discover how we can treat cervical dystonia.